hello, my we're going to do all of this kind of all apart. I like what you can see here. This is Latoya Alexander. She is a community health worker at our all things engagement. Losing 85 great portfolio going on over there to really make it work, and TCCN has jumped in great, and we are expanding our protocols and our cities. Everything seems to be going just done. I just don't know that means that you said everything's for good. So everything seems to be going good. They are working on our slides back here, and we can do a couple of things before we get started. That trauma informed care was actually a great kind of kick in. Yeah, it was a great kick on what we're talking about here. The mental health first, great stuff. All of that is integrated into our community training protocol. Latoya is a product of lots of trainings from across the board. The motivational interviewing stuff, to the MHFA, the trauma informed care. What is great actually being in that area? There's a lot of people. So we do have over there, we have access to everybody that you have access to here, I have access to here. It's great. It doesn't usually happen like this. It doesn't usually bring everybody together, but in that type of environment, it's wonderful for us to really figure out how to leverage the grant portfolio to really meet the needs and also support. So what we're going to deal about today is strength-based approaches for community care. And there are lots of different strength-based approaches. Let's talk a little bit about some motivational interviewing things. We're going to get into some transference and kind of transference and operational breathing exercises. And then we're going to do a little dance at the end. Just a little at the end. Yeah, okay, we'll save it for dinner. Okay, we'll save the dance for dinner. Are we up and running over there, ladies? All right. Latoya, can you set us off, please? Can you give us an intro slide? Oh, let's do it. Okay, all right, let's do something. Everybody else see me? Everybody see me? Okay. Any left-handed people? Yay! Yes. Okay, good. Y'all are supposed to be smart, man. I'm right-handed, but you know, there's supposed to be some difference between the left brain and the right. And we gotta do some exercises and our bodies kind of talking to ourselves. We're gonna talk to our bodies. So our first exercise that we're going to do is we're going to move. Let's rotate one hand clockwise or forward while the other hand comes back. Can y'all see? Don't go like this. They're not following anything. One is going this way. The other is coming back this way. All right? Oh. Yeah, got it? Okay. This is about being intentional. Like mindfulness is being intentional. Thinking about how we're breathing, thinking about how our bodies are moving, and little things. Oh, I'm not doing this. One is going this way, the other is coming back this way. Oh, yeah. Rotation, counter rotation. You go left to right. We'll get back to that. We'll try it again. I guarantee by the end of the presentation, our coordination will be on point. All right? It's mindfulness. So we have to learn about where our bodies are to be mindful of our space and what we're doing. All right, here's another easy. Put your hands on the desk in front of you, and we're gonna raise up alternate fingers. We're gonna go thumb, middle finger, pinky, and then we're gonna go fourth finger, ring finger. Thumb, middle finger, pinky, fourth finger, ring finger. Right? No. Every other finger. Okay. That's it. So you're going 3, then 2. You got that? 3, then 2. You can go slow as long as you're working with yourself. It's about being intentional. Those are the good things, though. You have to deal with yourself here. You have to learn our limitations. We all have to deal with ourselves. So So these are things that we're going to start working on today. We're going to think about being intentional. We're going to kind of begin to bring this concept of being mindful in mind. All right, excuse me, everybody. All right.
So the Tennessee Chair Network presents The Mountain to Mohammed.
That's right.
Community Health Worker TN Training Initiative.
That's right. So you all know if the people don't come to the mountain, we bring the mountain to the people. That's what community health workers do. They bring the mountain to the mountain. All right, let's go.
Workshop goals and objectives. This workshop focuses on resilience and recovery. Resiliency is the belief that individuals experiencing these challenges can and do get better and use their strengths to stay well.
That's right. Now, this is going to be strength-based approaches, and we're going to really operationalize resilience. Resilience has become a really kind of wastebasket term that we kind of use to define a bunch of things. But the nice young lady before kind of spoke on that psychophysiology of trauma. We're going to get all deep into that. I've got some nerd slides. I'm a nerd, y'all. We got some real slides. You get really into the psychophysiology of resilience, really operationalize what's going on up here as we become intentional right here. All right, let's go.
All right, goal. Reinforce core fundamentals of MHFA and community health work. The mental health first aid action plan assesses for risk of suicide or harm. Listen non-judgmentally, give reassurance and information, encourage appropriate professional help, encourage self-help and other support strategies.
So we're not going to kind of kick that mule again. You guys had great 8 hours with MHFA. Wanted to bring it back and tie it all into how this kind of functions with CHWs. So that the action plan, and there's also a toolkit. I'm sure they gave you access to that directly and to the rest of the resources. These are going to be great things to use complementary as you kind of think about developing your program. And this is kind of for CHWs and supervisors. Who do we have here? Do we have CHWs here? Everybody here? Yay! All right, any supervisors? Not really? We'll just do CHW. One super, okay, good. We're making this a la carte. This is great. And other interests. We always need other interests. That's great. Is Ely here? Ely Collins? He didn't make it. CHW from Chattanooga? Met him yesterday. Okay, let's go.
All right, learning objectives. Define motivational interviewing as a counseling style. Define the 4 principles of MI. Identify at least 2 alternative strength-based approaches. Demonstrate at least 2 methods of elicit change talk. Demonstrate skill with ORs, which is open-ended questions, affirmations, reflections, and summarize.
And that's kind of where the trauma-informed care just left off. So that's kind of a great place for us to pick up. I don't want to get too much farther into that, but the open-ended, she really did a great job talking about open-ended questions, setting up your evaluations and kind of how you need to stay non-judgmental. So this is a great time for us to jump into, should we wait? True? No, let's go. Let's keep on. Let's keep on.
Who are our community health workers?
I'm sorry, before we keep going. So Liz from Johnson City said that her board really wasn't feeling community health workers. So I know a lot of folks have to make a case also for who are community health workers. It's important for us to not only justify the position, but also to secure, support, and sustain the CHW, because you all are really the core of what we are all doing. So who are CHWs?
CHWs are shining examples of resilient, emergent community leaders. Community health workers are often reflective of the populations that they serve and have the following attributes. They are respected community members with strong interpersonal skills, intelligent and like to learn, excellent communicators, intellectually curious, and open to new ideas.
I know we've just defined all of you all out here, because those are the kind of the characteristics that we look for in terms of community leaders, and also these kind of trusted messengers. And then so beyond having those basic interpersonal skills, there's also a set of kind of structural things that help with this approach, and also things that we have to be careful about, because as community health workers often reflect the communities that there are also a lot of triggers involved with community health, the things we need to take care of ourselves, and the things so that you can be, I guess, you can be better able to take care of your clients. But these boundaries, the self-help things, the triggers, recognizing your own triggers and recognizing the trauma inside of others, that vicarious trauma experience that you're feeling, and the empathy associated with it are great for your ability to perform, but they also, you can take it home with you. And it takes a lot to become a fully functioning, sophisticated CHW that can kind of handle it, marginalize or maintain strict boundaries around the clients, because our clients have boundary issues. Some of our parents have boundary issues. Well, it's very challenging, and it's something that we, from a managerial standpoint and from supervisory standpoint, have to be careful with and always. You all make sure you raise your hand when this is happening. When you're being triggered, come to your supervisors, bring it to them. If they don't see it in you, you bring it to them, because these triggers and these situations are important in terms of sustaining your role and your ability to function.
All right, CHW functions. CHWs enhance the following functions. They improve health, behavior, and outcomes, serve as a bridge to cultural and linguistic barriers to good health, and expand access to care and coverage.
Right. Now, again, this is more what you're taking to the board. You guys already know this. Let's keep rocking.
All right, community health worker typical responsibilities. CHWs cover a range of responsibilities, including but not limited to conducting home visits, community contacts, and other related outreach activities. We assist clients with goals and goal setting and problem solving, help clients access and receive the care they need, help clients prepare for and follow through after medical encounters, advocate for clients' community health needs, link clients to community-based resources and wraparound services, host community-based small group sessions, informal meetings, and community events, to provide culturally and linguistically appropriate materials and messaging to community members.
Now, a lot of your work happens outside of your institutional settings, outside of the clinics. You do a lot of home visits, you do community engagement events, you may have prevention parties, you may have outreach education things about COVID vaccine hesitancy. So you all know that there are different policies that are, well, your agencies probably all have policies for contacts outside of the clinic. And these are things that you really should adhere to. There are a bunch of environmental things that you all are familiar with, because again, typically you reflect the community. So that's one kind of good edge that CHWs bring to the department. But on the other hand, that familiarity can also open you up to vulnerabilities that you have to be very careful with. So those are things we're going to keep touching on as we move through. I'm going to, I'd like to play this a la carte. Oh, excuse me. I should have said Lauren Brown was supposed to co-present with us today. She had a family emergency, so she could not. She's our trauma-informed care. She's a social worker, but she's also really good with our motivational interviewing and things. So our best to her as she travels. So we're kind of rocking it without Lauren. We're doing this a la carte here. So bear with us. Thank you. Let's go.
Nationwide profile of CHWs according to the Bureau of Labor and Statistics. There are approximately 58,670 CHWs employed nationwide. Of 48,000 CHWs nationwide, US, well.
Yeah, that's kind of, and we don't need to, we can skip past that too. So this is just a bigger profile. Lots of other states, Tennessee, I don't know if you know about the politics. Tennessee didn't do Medicaid expansion around 5 years ago. A few of our other neighboring states have state credentialing programs for CHWs. We technically do not. The Meharry Vanderbilt Alliance, I was working with the Meharry Vanderbilt Alliance to work on our credentials and standards for the state. They kind of, TDH is still kicking those standards around, but the state hasn't really agreed, I shouldn't say agreed, but embraced the the standards and protocols. We have several surrounding states that have certifications in CHWs, and that's where a lot of those numbers are coming from. But it's a growing movement, and we are looking forward to securing long-term funding to really keep it real in Tennessee. Let's go.
All right. M&M CHW training model.
All right.
This train the trainer model includes, but is not limited to, onboard training in HIPAA, hazmat, CPR, cultural humility, responsible social media, and ongoing supervisory CHW core competencies training.
This is the basic of our simple core training model for our CHWs. And all of you all are case specific as well, but depending on the region you're in, also depending on the, I guess, what do we call that? The domain, or if you're in cervical and breast cancer, if you're in addictions work, if you're doing dental, you have a bunch of different responsibilities that are associated with the individual clinic. So depending on your area of expertise, or depending on your area of funding, you will be custom cutting your CHW responsibilities. These are core fundamental stuff, that MHFA, the motivational interviewing, the boundary stuff, the HIPAA stuff, the hazmat stuff, is stuff that everybody needs across the board, like as fundamental basic credentialing or basic training for community health workers, regardless as to whether you're doing breast and cancer research, HIV research, excuse my word, engagement, whether you're doing breast and cancer engagement or HIV or substance use and abuse. You will have different complementary protocols that will feed on top of your basic training. Let's go.
Right. Additionally, the M&M CHW training protocol is augmented by booster courses in nonviolent conflict resolution, strategies for de-escalation, mindfulness, motivational interviewing, pharma-informed care, and mental health first aid core competencies.
That should have been trauma-informed care. Use that. But and that's a lot what we're getting here. Part of what TCCN does, we provide a lot of TTAs, regular trainings going on for everybody. Not only these meetings together, but our monthly TTAs for these different kind of booster courses and things. We're absolutely open to engaging all of you all on an individual or clinic level for subsidizing any one of these complementary trainings. So please reach out. We can absolutely make it work if it's not already a part of your integrated protocol.
All right, CHW educational philosophy. Educational philosophy. Identify community leaders and stakeholders, train the trainer, and make it peer-to-peer.
That's I like that. So the true community health workers are truly emergent community leaders. They are trusted messengers within the community. There's a difference between emergent and appointed leadership. So you all know all of this. And so the idea is that the trick to community health work, or to getting good community health workers, is that right there. Identifying emergent community leaders, not necessarily appointed, right? So you identifying emergent community leaders and stakeholders, training the trainers, and implementing a train-the-trainer model, and keeping it peer-to-peer, meaning this peer linkage to care context throughout a bunch of different social structures. A lot of social science that speaks to the validity of peer education. It's some of our strongest suit, especially when it comes to like vaccine hesitancy, miseducation, and all of these other things. So and all of you all know who have kids, your peer, or who have been kids recently, your peers are very influential to you across the board. So the idea here is that we can structurally identify, that we can formally identify, train emergent community leaders, and then treat them as in the responsible position, fully fund them, pay them good, and treat them right. That's the big idea. Let's go.
Yeah, M&M CHW training model is designed to support the development of sustainable initiatives that increase community protective factors, decrease risky behaviors, and support workforce development initiatives in the underserved communities of Tennessee.
Lisa should take that to her board, because that's very important to be able to do. Let's rock.
All right, why MHFA? MHFA is a standardized training that can provide CHWs with the knowledge and skills to serve as first responders and primary ports of contact for patients who are hard to reach and/or have dropped out of care. MHFA core competencies: depression and mood disorders, anxiety disorders, trauma, psychosis, and substance use disorders.
Now, no, this is not designed for you all to become experts in this. It's more about appropriate referrals. So the idea that on the front line, you all are the first point of contact for a lot of our clients and for a lot of our people and their families and everybody. So the idea that you are astute in picking up on these triggers and these cues, that you also know a proper referral protocol and you can respond accordingly, is what helps you be effective in terms of our kind of paraprofessionals. So you all are out in the field and you are our first contact. You're the first time that folks can engage with services, and you tie them in, bring the wraparound in, and you support them in where they come. It's very important for as agencies to have standardized, which is a great, fancy word, standardized trainings that they can check their box that you all are giving regularly that reinforce these things. MHFA is a great way to do it, and this is a great start for you.
CHW training focus, communication skills to support client engagement and re-engagement. Introduction. This CHW training focuses on the fundamental skills of community health work to help the CHW engage and re-engage hard-to-risk or at-risk clients in treatment and wraparound services. Engagement skills include, but are not limited to, strategies to recognize and address stressors, feelings, and anxieties associated with CHW tasks, duties, and responsibilities, mindfulness, breathing techniques, using timelines to identify and map sources of stress, resilience training, and the importance of hope.
That's important.
Huh.
Hope's important.
It's very important. Using a strength-based approach, using data about knowledge, belief, and attitudes to make data-driven decisions and inform the community engagement process.
And that's exactly what all of you do. And it's important to kind of adopt this language into reporting what it is that you do. Our strength-based approaches, which is probably what we'll skip to next. A strength-based approach is exactly what it sounds like. It's using the strengths of the clients or whatever they have around them, the capacities that they may have and be successful with, to build on that. And when you have a strength-based approach, it's not a negative, it's not a judgmental top-down position. It is using the client's strengths in order to move them along the continuum of health. That is by far, the data shows that is by far the best approach for community care. And I would encourage all of you all to adopt a strength-based approach across the board.
All right, so using a strength-based approach to engagement. Identify areas of strength or success in a client's timeline and build on these examples. Graduation from high school, has a supportive partner and or family, supportive network, a period of successful employment, religious or spiritual support system, hobbies, talents, special skills, and or passions.
I'm going to ask the employer to give us a real world example of that in the real world. He talks about a client strength, one of our clients, somebody you got to focus on their strengths.
So, since I started in Meharry maybe 6 or 7 years ago, and I've been dealing with a patient who is just having issues all across the board. And so the last conversation that we had, I was able to tap into, you have your daughter needs you. And that seemed to be the only thing that it brought a tear to her eye. So that is kind of what we mean by just, I'll say this, the family network, using the family network to pull from. Again, it's been 6 or 7 years, tried everything, but nothing got to her and nothing made her make the decision to further her care for better health until we actually spoke about her daughter. So
yeah, perfect. That's a great example. So again, it's up to you all to kind of navigate these waters. And sometimes it takes a while to figure it out. What our client acknowledged as a strength, she might not have even seen as a strength originally, but she has a delightful daughter that needs her to be there for her, and that stuck with the young lady enough to kind of move her in the right direction, we hope. But the point is that every engagement needs to be from a strength-based context. And you got to keep fishing until you find something that actually sticks with everyone. All right, let's rock. Thank you.
All right, mindfulness and resilience skills to increase CHW outreach efforts. Mindfulness skills to help identify stressors. Mindfulness is a type of meditation in which you focus on being intensely aware of what you're sensing and feeling in the moment, without interpretation or judgment. Practicing mindfulness involves breathing methods, guided imagery, and other practices to relax the body and mind and help reduce stress.
We pause right here and do a breathing exercise. That would be great. All right, we're going to do breathing exercise. It's easier with the hands.
Yes.
Then we'll try those again. After we relax ourselves, we're going to try our hands again and see if our hands work here. All right, you're leading us, Latoya. Tell us. I'm going to do it. I'm doing what you say.
Make sure you're sitting or standing in a comfortable position. Avoid fidgeting with your body.
That's important. Avoid fidgeting.
All right. Close your eyes and imagine you're somewhere safe, warm, and happy. Take a slow breath through your nose, feeling your lower belly expand with air. Hold your breath for 1 to 2 seconds. Exhale slowly through your mouth, feeling your lower belly flat. Wait 1 to 2 seconds before taking your next breath. Repeat this cycle for 2 to 3 minutes until you feel completely relaxed. And so this exercise is done by contracting the diaphragm, a thin horizontal muscle beneath your lungs. And this is also something that singers and yoga practitioners will use often just to help with your breathing.
Oh, worked for me.
Okay.
Is it working? Yeah, that's right. We're relaxing. Y'all want to try it again? Can y'all do the pat your head, rub your belly thing? Okay, all right, let's keep going.
All right. Spending too much time planning, problem solving, or daydreaming, thinking negative or random thoughts can be draining. It can also make you more likely to experience stress, anxiety, and symptoms of depression. Practicing mindfulness exercises can help you direct your attention away from this kind of thinking and engage with the world around you.
This isn't just important for community health workers, but it's true for every relationship that we're in. It helps with your family. It helps with every situation that we're in. If you can take some time at your desk or in your car to kind of center yourself and focus on what's going on, focus on breathing and focus on that kind of interactive process. It's all about you staying mindful with yourself. It helps to center yourself. And that helps you with your responses as opposed to reacting. Because so much of the MHFA and community health work is about calculating responses over reacting. So we want to mitigate reaction and support responses. And that's what we do that by, blowing our belly out, taking everything back in and staying very intentional. This is great. Let's keep rocking. Can you get a time check, Mary? Yeah, great, thank you.
Universal precautions for preventive behavioral health literacy.
Yes.
Universal precautions for preventive behavioral health literacy is a body of knowledge, skills, and behaviors that help to prevent behavior-related illnesses such as HIV, AIDS, substance abuse disorders, and stress-related disorders. Diabetes, hypertension, and heart disease are also known to be influenced by behaviors such as overeating or lack of exercise.
We know that's important. I'm using this, taking this as a shameless plug for health literacy. We'll get in. I think that might be next. There's a health literacy is a huge concept, but basically it's about helping people understand health information, whether that's reading the back of a pill bottle, or understanding how to take your prescription, or understanding and interpreting providers' instructions. Sometimes there's some language barriers, sometimes there's some cultural barriers, but helping to kind of move health literacy along the needle. One, it's a needle that your agencies can measure. So health literacy is a great measure. I'm a quant guy. I'm always into what we can check and measure about this. So adopting kind of a health literacy context, and promoting health literacy in your clinics and in your agencies helps it helps across the board, but it also can help your clients better understand what their providers are trying to communicate to them. That's why we have it here. That's right.
All right, why health literacy? According to the Centers for Disease Control, health literacy is the degree to which an individual has the capacity to obtain, communicate, process, and understand basic health information and services to make appropriate health decisions. Persons with limited health literacy are more likely to skip preventive services, enter the healthcare system when they are sicker, have more hospitalizations, be less able to manage chronic conditions, and report that their health is poor.
Right. So it is very important for us to kind of engage health literacy. It's something that you have to assess and address, because we can't take for granted that everybody's understanding these instructions, even from yourself. So as we kind of give these, CHWs are much better at giving lay instructions. So typically you all don't talk with a bunch of doctor talk and things. You kind of lay it out straight, which is good for people. But beyond that, their ability to understand what they're supposed to be doing, adherence to their medicine, the importance of maybe drinking water or taking it with food or whatever, whatever it may be. The idea of you reinforcing those kind of subtle fundamentals. And this also bodes well to prevention, because it's really hard to kind of assess prevention, because it's hard to prove that you were the reason why something didn't happen. But on the other hand, our agencies need for prevention. They all have prevention initiatives, and we all have to, kind of engage in our outreach. So depending on, as CHWs are funded under different umbrellas, under outreach context and under kind of sometimes cultural strengthening context and things, or linguistic barriers, as these are coming around, the idea is to bring all of this full circle underneath the big umbrella of CHWs, which is why y'all are the greatest. Let's go.
All right. Health literacy toolkit.
Yeah, we don't have to get into this. There's a health literacy toolkit. It's pretty easy to find. There's the citation for it. You guys can adapt and modify it. It's pretty wonky. So you do it yourself before you try to take your clients through it. It's not as user-friendly as I would like it to be, but I think it's a good resource for you all to use. And also, again, it's public domain, so you can jump on it, modify it, and use it however you like.
All right. Resilience to stress. Resilient individuals demonstrate a narrow and conservative band of responsiveness to stress. There have been numerous studies which show that performance is enhanced when there is optimal sympathetic nervous system activation.
Get me, yeah.
Meaning low levels of baseline epinephrine with robust increases of norepinephrine and norepinephrine.
I told y'all I threw my nerve. This is important. I wanted to prove that this is, again, there is a bunch of chemical stuff happening when all this is happening. Being resilient isn't just the way you look. It's a chemical, it's the way that your brain is kind of built up. And the more you practice these kind of contexts, the way you can reinforce these support structures, and you can reinforce the reward systems in your own brain. So resilient individuals kind of move their dopamine, let me use smaller words, they move their reward systems around so that, being engaged, the success of resilience is rewarding for them in general. So it becomes a whole part of your whole context. It's important, and I wanted to throw the chemical language in there to say this is not just smoke and mirrors, and this is real psychophysiology and psychobiology. That's right. I don't do too much of that.
Try to plug it in.
Oh, we blew it?
Your battery's running low.
Oh, I'm sorry. Yeah, I thought we were plugged in. I thought I charged. You know what? I think I need a new one there. I think my battery doesn't stay charged.
Really?
I don't think it holds a charge. I don't know. It was charged. I charged it all night, and now it just ran out. It's gotta be a plug.
It's over there. Hang on. You know what? Why don't you do your best to keep going?
Okay.
And what I'll do is get the tech guy.
All right. No, we're good. There's gotta
The
be.
psychobiology of stress.
We're gonna do one more nerd slide, and then I'm gonna stop. I promise. Let's go. I love this stuff.
Southwick, Osbey, Charney, and McEwen describe the psychobiology of stress and the process of adapting to it. They identified a set of primitive but effective means to improve the odds of survival. The classic fight or flight response involves activation of immune function, energy mobilization, and memory enhancement to recognize and avoid similar dangers in the future.
All right, now I am going to stop there on that. But this is important because this is old brain stuff. It's happening back in the back of your brain, down here by your spinal cord. It's been around for a long time. This is fight or flight survival stuff that's baked into our brains. So it's important to understand that this is really affecting how people are moving. And it affects how we're moving as well. So kind of this understanding and empathy of how other folks are, it helps us a lot to understand how we are in our own physiology, to understand our own limitations. Do you have that acronym right there? No, skip that. The other one. Remember the little acronym that was talking about was it truth or jewel? Oh, excuse us. Sorry, everybody. As you were. Sing a song while they're doing it. Yeah. They're working out. We good?
All right.
See, y'all missed the song. Maybe we'll do it.
Our resilience are reframe the problem and find reasons for hope.
Okay, I'm gonna do that on the back end. We can do it. You know what? Let's go to transference and countertransference. Yeah, I think it should have. Yeah, I think we skipped that. Yeah, I think let's go back up to that. Let's back up to countertransference. We'll do resilience in the next. We'll do that. We'll do resilience in the next section. Our next session is operationalizing resilience, everyone. We'll come back for that at 3:30 or whatever's next.
So countertrans.
Yeah, we want transference and countertransference. Yeah,
So here we go. There we go. Understanding transference and countertransference. Assessing and addressing transference and countertransference. Memories and feelings related to traumatic experiences can complicate CHW's re-engagement efforts. This training will help CHWs to identify stressors in their own lives and in the lives of their clients, provide positive and helpful responses to the stressors that are identified.
Right. That's important because remember, your reflection of the community is what makes you valuable to the job, but that's also what makes you vulnerable to the clients. So we have to be very careful. We have to learn how to recognize these things between us and between us and our clients.
Right. At its core, so transference. At its core, transference occurs when feelings that you have for one person are unconsciously redirected to another. It happens every day in multiple settings. However, this can prove to be both insightful and problematic in a therapeutic relationship.
And you see that all the time. Somebody reminds you of a mother, somebody reminds you of a grandmother, or somebody reminds you of somebody, one of yours that you didn't appreciate so much in high school, right? You have a totally different response to that person based on their reflection of whatever else that experience was. It's important to be able to recognize that because we tend to lean in when there's a grandma figure and we are, we tend to get the benefit of the doubt more some, and then we tend to be more defensive and protective of others. These are actually feelings of transference, and you have to be very careful with this happening so you can calculate the response. That's right.
Imagine that you meet someone while grocery shopping who reminds you of a beloved aunt. Without knowing it, you may treat the person kindly and even engage in more in-depth conversations than you would with a stranger because you are projecting your feelings of your aunt onto this person. In a therapeutic relationship, transference gives the counselor or CHW insight into how a client might interact with someone in public. With proper training, a CHW can recognize when transference is occurring and use it as a means to guide interactions, allowing the client to work through emotions with the CHW they may not be comfortable discussing with other people.
That's right. So part of the exercise is to just recognize when it's happening. If it's happening in the grocery store from that aunt figure that you saw, the point is to start, remember this mindfulness, start looking inside of ourselves and saying, what is making me want to lean in here? And what's making me want to resist here? See, these are all sophisticated psychological phenomena. And what's happening there is that's transference. You are projecting feelings for someone else onto this. That can help you in a therapeutic relationship, but you can also see how it can hurt you. So let's be careful. Let's be mindful of transference. All right.
Countertransference. Just as transference is the concept of a client redirecting feelings meant for others onto the CHW, countertransference is the reaction to a client's transference. In this context, the CHW inadvertently projects his or her feelings onto the client. It is important to point out here that the way CHWs use countertransference can make it either helpful or problematic.
Reinforcing the same point. So this idea here that transference is happening, and it's a natural human phenomenon. There's usually some sort of projection going on between individuals when they interact. Every situation, they say situations are circumstantial, which means you're bringing all kind of different experiences into the situation that you're in then. The question is how folks are reacting and responding to one another, and how the feelings are being projected from other things. The more aware you are of that happening within your own space, the more control you will have over the dynamic of the interaction. And that's very important in a therapeutic relationship, because remember, you have to establish these boundaries. You don't want to get pulled in. A lot of times clients will also notice the counter transference or pick up on the counter transference. If you're not savvy, they'll pick up on counter transference and perhaps manipulate the discussion into a different direction. So your job is to notice what's happening within yourself. And again, this happens in all different relationships. You can practice this with your family, you can practice it with your colleagues. You have to practice it while you're mingling and walking around everywhere, because the idea of these feelings that you're associating with this interaction, and whether or not those feelings are, I don't want to minimize them, but whether or not those feelings are valid at the time, you have to practice controlling that. You have to practice understanding that in real time so that you can slow it down when it's really happening, and you can stay in control of the therapeutic relationship and maintain its boundaries. That's right.
A CHW may notice him or herself reacting more positively to a client that reminds them of an old friend or colleague, or may take on a more parental tone with a client who reminds the CHW of one of their children.
Be very careful with that
A well,
one. Right, we see that a lot.
A well-trained CHW can recognize these feelings and may even bring them up in session. In this regard, the CHW may be able to use his or her feelings toward the client to understand how other people in the client's life feel about the client as well.
That's almost profound there, right? You will be able to use your feelings toward the client in that session to understand the other people in their lives' feelings toward this client. Now that helps you to understand and help to develop the context about how this person is existing in their own environment. But you have to understand that. You have to have some empathy for their situation for you to be able to kind of help them inside of their situation. So it's not a top-down approach. It's a very empathetic approach that requires you to be grounded in yourself to actually know what's going on with everybody else. That's what's so cool about all this.
All right, when used properly, countertransference can be a valuable tool to look at to look into the insight of those in a client's life. However, when unrecognized, it can pose a threat to both the therapeutic relationship and the healthcare goals set up by the client and CHW.
Absolutely. So sticking to your goals and your boundaries, actually, I think we're going to get to that next. Sticking to your timelines and your goals and your boundaries. Well, I should have started with this. Developing your timelines in the first place, having these kind of reasonable goals and objectives and these benchmarks that you can meet in real time need to be based on your interactions with these clients, and they need to be realistic in the context that clients can actually achieve these goals. So this is a great way for you to assess the process and then sit down to actually structure something that you can move forward. We want to be systematic about this approach, and we want to be careful that we are not leaving ourselves vulnerable, and we're also not missing teachable moments. I think this stuff was very helpful to learn as you know, as a parent. I've got 4 kids, and understanding this developmentally really helped me in terms of, you know, understanding my relationship with my dad and how, you know, that helps me a lot with understanding my relationship with myself. So but it's about me understanding my relationship with myself that puts me in a better context of communication. I also just learned about my love language. It's a new thing for me. Oh, well, okay, yeah, that's right, yeah. Just learned about it. Yeah, well, really quickly, it's quality time and physical touch. Yeah. Quality time, physical touch. I just took the test. I didn't know there was a test. Sister asked me what was my love language. I said math and science. She told me that was wrong. She was like, not even close. That's not it at all. You need to take the test and learn about yourself. So I've done it, and now I'm here to report I'm better because of it. So this is all about, you know, mindfulness. Gotta learn about ourselves.
All right, timeline analysis.
Yeah, let's talk about time.
Process. Help CHWs to create and analyze timelines for the clients of interest, concern. Also, create timelines for CHWs to be kept between CHWs and supervisors, not for sharing with others, but it will be a tool for understanding one's own response to stress.
That's important too. So this is also about your reaction and your activity with your supervisor. So this is when we first start to build our timelines with our clients. Whether it's about some adherence to a prescription, whether it's about vaccine hesitancy, or maybe we're trying to move them along the needle to improve or to affect their perceptions of the healthcare system or whatever. We may have some time. You may sit with your supervisor and say, okay, well, this client is on a 6-month rotation. They have 3 visits. We would like to move them toward disclosure over this amount of time. We would like to move them toward whatever the goals are. If it's adherence, if it's disclosure, if it's bonding, if it's about reporting, if it's about moving in a different area toward with their employment or something. Putting together, or family things about going to some therapy or doing some other sessions. As you're putting these things in line, these kind of objectives for your clients to meet that you can measure as they go along, so we can demonstrate them moving the needle. As you set these up, it's very important for you to be conscientious of them being realistic and achievable and attainable. And I think we're about to get right in the timeline. So let's roll.
And we have 10 minutes.
We got 10 minutes. Okay.
9.
9 minutes. Okay, so maybe we'll pause. Maybe
We'll finish this slide.
Questions? That's cool. Let's do that. Let's do that. Are there questions? There's questions, everyone? Talk to. Yes, no? No questions? Really? It's that? It's been that enthralling. No questions? Okay. Yeah, I'll finish timelines and then we'll cut you a break. Okay.
Assist in developing treatment plan timeline, age and events, benchmarks and milestones. Developmental timeline, childhood to adulthood, educational and work timeline, partner success and failure timeline, family and support network timeline, and last but not least, drug and alcohol use timeline.
And these are different, depending, again, you guys got different clients, so you'll have to use different timeline strategies for different folks. We encourage our CHWs to make these timelines for themselves as well. Like to kind of just, again, you map out all these other things. All of this is helping you, learning about your interaction, and I'm sure Latoya will give testimony to actually learning these techniques and strategies helps you engaging in every aspect of life, not just with clients, but with colleagues.
Oh, yeah.
Yeah, we have a lot of colleagues, a lot of stuff to deal with, but we have to use these techniques along with each other too, because these are very good things. This is just useful stuff. Whether you're talking to clients, kids, or family members or significant others, this is all really, really good stuff for all of us to know. And it helps us to do well.
What you're saying is you think along these different continuums with your clients, like you think about where they are developmentally, where they are in terms of, their education occupational goals, their work goals, and kind of say, well, here they are, what's a reasonable timeline for them to make it to this benchmark or to the next? Is that what you're doing here?
Generally speaking, yes, and also that's also what helps you to figure out your strength-based approach, because as you lay these maps out, you can identify strengths that your client might not know. So they may not see they're getting the GED as actually a strength in their developmental objective, but it may be something for you to work off of in terms of time, especially if they're interested in pursuing more education, or if it's about children, or if it's about a family, if it's about education, about work. There are so many, and cognitively as well. So there are so structural and cognitive things that the providers will be working on. Again, this isn't psychotherapy, so your job isn't to be a psychiatrist. Your job is to lay out these reasons, to do the analysis with your clients, to become familiar with them in terms of timelines and how things move along with each other. And you can identify strength-based approaches in that context so that you can work with them, and you can also figure out which things you can actually advance, because you want to show progress. And to everyone, not only to your funders, but to your clients. You need to be able to show that these clients are actually moving in a specific direction. The more timelines you set up, the more opportunities you have.
So you really want to think about all these different levels.
Yes, and domains especially. Absolutely, that's right. And think about people in different areas of their lives, because we all exist in all of these different levels of our lives. We have a work life, and home life, and family life, and the question is, how are all of these things actually coming together in the therapeutic context? CHWs are great because they can actually push. Latoya can push a lot harder than Dr. Berto can on a lot of levels. He's got a lot more restrictions to what he can and can't say. Latoya can push a little harder, and than the providers can. So CHWs actually have a nice gray area to work inside of, and they can move the needle. I think that they're some of the only folks that can actually because of that. That's the way to do it. So we'll pause right here, everyone. We'll sing and dance when you get back. Take a break. You guys are doing great. Go team. Woo woo. All right. Oh, please. Oh, thank you. Yes, please. I absolutely would like you to fill out your evaluation. Thank you. If you did not count it, it did not happen. All right. That's right. It didn't happen if you can't prove it. So let's please.
3:45, I think.
Okay. 3:45.
3:45, yeah.
Thank you. We'll start with the song. We sing when we get back. All right, good job. No, good job. You did great. No, I'm fine. Yeah, you did great. Thank you.
Oh my gosh, where is this plug? What is that?
Did he find it?
I think he did something. Yeah, he did something. What did he do? I don't
He
know.
plugged. There's usually a plug in the podium.
He unplugged something.
He did,
Unplugged
because your
something.
plug is over here. So this is not helpful. We don't know what he did.
We don't know what he unplugged.
Oh, look, wait. Here it is. Here's something.
Yes.
Here it is. Okay, now we see it. There it says there is something.
Yeah,
Trying to plug in the song.
yeah, it's,
Yeah, don't talk over that quick. And be sure to project your voice.
Oh, I'm sorry. I'm not.
Fine. I think it was, you could be heard.
I usually talk too loud. Yeah. No, I usually tone that down because my daddy told me talk like you got something to say. So,
Well, you
yeah, I ain't never, okay. Okay, thank you all. No, I'm good. You good. Thank
You want to have chairs?
you. Thank you, ma'am. You guys are doing great. I appreciate the love.
You don't need water?
No, I'm fine. I saw your session yesterday, and that was great.
Oh, thank you.
We have those recordings yet, but to work in Nashville. We want to put them all in one section of the website so people can go. Sections by page. Not only. Not all the sessions were recorded, but these ones were recorded. I'm going to start this recording. You did record yours, right? Yes. Okay. I will go there.
I'll send you all of the development slides, but
This one didn't, it was not recording.
Oh, no.
It, for some reason, internet connection.
I couldn't get to it in my room at all.
No, it's terrible.
Yeah, he shut it
That's
off.
the only negative thing that I have to say, that the Wi-Fi has been bad.
Yeah.
Here, there's a different one. Graceland 22.
It was working her room, so we should give grace to the guests.
Yeah, in the room is guest, Graceland guest. Here is Graceland conference. So here it asks you for the access code, when in the other one it asks you for the password, which is your last name and your room number.
Looks like Ammo beat me to it. She's not the one.
No, it was not recording. It said that the internet connection failed at some point,
Okay.
but we need to see if, now that we're going to
We're for
3:30.
sure gonna record this.
I'm gonna see you on the dance floor tonight.
But I will certainly try.
Give it all I've got.
Oh,